here with Minister of Public Health, Dr. George Norton, and we'll be looking at the sector's performance for the past 6 months. Minister, thank you for being with us.
Thank you very much.
Firstly, I would like you to give me an overview of your term in office. The past 6 months, I know you took over from the previous administration, and there have been some challenges and achievements. Can you elaborate on those for us, please?
Well, I must say that the challenges were numerous and still are. The achievements of a lesser, let's say, quantity, but we hope to improve on our achievements, especially in the new year and the years to come. I was particularly challenged with the infrastructure that we meet in place and the systems that might still be in place. My first approach was to get on-site idea of what actually exists. And unfortunately, it was not pleasant. I have visited as much as I could within the short space of time and that which permits. I still have much more to do. I've been to Region 1, Region 2, 3, of course 4, 5 and 6, and 7, some amount of 10. I'm familiar with what the situation is in Region 8 and Region 9, but I still would want to go and make a more in-depth evaluation of what it is in Region 1, 7, 8, and 9. Those are the hinterland communities. I'm familiar with the geography of Guyana because I have visited those areas. And because I've been shadowing the Ministry of Health for some years, I am, even before I took office, quite familiar with what exists. So we're working in that particular area of improving on our infrastructure. Along with infrastructure, we've got that chronic problem of personnel shortages. We need particularly more nurses and persons in the, let's say, administrative level. I would love to see or have more access to personnel qualified in the area of public health, masters in public health, which is a requirement for one of our principal health officers, that is the regional health officer, is a specialty or a qualification that is terribly lacking here in Guyana. I must tell you that I was accused in Parliament of employing persons who are unqualified. At this point in time, I'm more interested in who can deliver, rather than if somebody has the academic qualifications to fulfill certain positions. I say so because while one cannot get away from the political tinge that is involved in appointment, yet we still have situations where persons have been functioning in particular area in the past government, and according to them, they were doing a good job. So I don't see why I should be, it should be held against me, particularly because we don't have qualified person to fill certain positions for me to appoint persons who are not qualified.
Okay. Minister, what would you say has been the area with the biggest achievement in this sector so far?
I must confess that there has been no big achievement, so to speak. But we have improved in certain areas. I would be most happy to have that position of Deputy Chief Medical Officer filled, which has not been so for the longest while, because I think the public service has created that position, and it was done for a reason, and we should fulfill that. For so many of the different areas in the health sector, you had persons acting and probably because they are not academically qualified. We managed to get a director of regional health service, and I think that is so important. Failed. Um, uh, you know, it's one thing having the qualifications, but there's another thing with the experience and the hands-on approach that one might adapt. So we are hoping that we would improve in our regional health service because we have managed to get a regional health director. So in that area, yes, we are expecting some improvement. We are also um, expecting some improvement with respect to the procurement and distribution of pharmaceuticals and medical supplies, because we have changed the system which existed for the longest while. But like all changes, we have teething problems. The whole idea of giving the budget allocations to the region for them to decide what they will want, and then, um, you know, the central government will procure these medications and then send it out to them, is a new system. The open tender competitive bidding is a new system in the health sector. We haven't had a smooth transition to that, but I, in the end, would hope that that will be seen as an improvement as compared to what we had before, dealing with a company that leaves much to be desired in their track records for having received payments and not delivering on the medications and so on, the shortness of our drug shelf life and so on. We hope to improve in that area. But I must tell you that there were two particular areas that I would have loved to see more improvement on. I know the time is short, but the people are expecting changes. I would have loved to see we would have a lower maternal and child mortality rate. I say this because, along with Haiti, Guyana is placed in that category of having the highest. The thing about it is that from a commission of inquiry that was conducted by CARICOM, Guyana was fall into that category of no improvement. Yes. You know, and even though it is my desire and will always remain my desire not only to reduce it but to maintain it at a lower level, we haven't had too much success. 7 months would have meant what? You reach a system, there's very little you can do to change it, and as a result, you will get the same thing. Because if we continue as we were doing before, we won't expect it. We can't expect any improvement. What we plan to do is to seek help, of course. We have been criticized for seeking help from overseas, but that's where you have to go, because we don't have it locally. There's no other way you can go. Of having some UN volunteers in that particular area of maternal and child health, but specifically with our gynecologist specialists, the gynecologist obstetrician. If we can have more of them available, practically one in every region or more than one, in every region and so on, we might be able to pick up in time the high-risk patients, so that by the time they reach the time of delivery, they're placed in a position where the risk would be very much reduced in terms of if it's necessary for them to come to the Georgetown Hospital and be in a halfway house or be even on the ward. That might save a lot of maternal deaths. So we're hoping to go in that area. Of course, all of these take time to get, if we're asking for UN volunteers, then there's a process, there's a procedure, and it wouldn't happen overnight. Those that we have on board might be limited in terms of the numbers and so on, and the facilities with which they have to work with. But we're trying to have a better communication with, especially in the distance region of healthcare delivery, particularly to maternal patients. We took a licking with our child health, the infantile mortality, especially with the neonates. But that has always been high. It has always been high, and basically, they die from due to infection. The babies that premature or preterm, the immune system is not developed, and as a result, the resistance to bacteria is very low, and they die. We have, done a lot in that area, particularly at the Georgetown Public Hospital, and I think I'm happy with that result. But we've got so much more to do in that particular area. The idea about healthcare delivery in those sensitive areas is to maintain the level or the quality of healthcare that is being delivered. And unless we do that, unless we are consciously working towards maintaining the standards that we have set and achieve, then we will always have that lapse. And then all of a sudden, the mortality rate goes up, and we have to close down units that have been functioning. Or we find that we have to not only be conscious of the actual delivery of health care, but we've got to also take into consideration the availability of what is necessary for those units to function. We need hand sanitizers like if it was just invented, meaning we've got to keep hand sanitizers for those nurses so abundantly and relatively easy for their access, as well as towels or whatever it is, and maintain the sterility of those departments. We're trying to extend that area to include Bartico, and obviously, we have to look at places like Mabaruma and Letham and probably Skeldon. But as we extend our reaches in providing neonatal care, we also have to try to maintain, what we have already said. The Georgetown Public Hospital has got to maintain its level of quality. We expect the West Dem to, surprisingly, after doing all the work that was necessary to open that unit, only to find that while the unit itself was ready for the babies and so on, when rainfall, the roof was leaking. So let us be practical. The best hospital is a wooden structure. That was there even before I grew up. And I doubt whether, in spite of the renovations that would have been made, whether it is completely done. So like the Saudi hospital, which might have been a little, let's say, more recent than the best hospital, we will find these things happening where the roof is leaking. When you do work on the third floor, on the second floor, but you didn't know what was taking place in the third floor and the roof. Okay, quite unlike the New Amsterdam Hospital, where a new building was constructed, those buildings would always come down with infrastructural defects, and it would affect the quality of health care that we give her.
Okay, Minister, if I got you correctly, you were speaking about the neonatal intensive care units, and you're saying that there are plans to establish units at the other hospitals?
Right.
Okay. Moving on, with regards to HIV/AIDS and PMTCT, Guyana is on its way to achieving elimination status for mother-to-child prevention. Can you elaborate a little on that? What are the achievements and the way going forward?
Okay, we've got a fair amount to pat ourselves on the back where HIV/AIDS are concerned, and credit must be given to where it is due. The doctors and the healthcare workers in that area have been doing a good job. Okay, and when you compare the international or the worldwide level of the HIV, it has literally become a chronic disease now. Okay, and already the World Health Organization is talking about the complete elimination or eradication of HIV, even in 2013. But for us to do that, we need an accelerated approach, and hence they've come up with this strategy of 90-90-90, meaning that by the year 2020, 90% of persons with HIV should know their status. And 90% of those who know their status and are positive should be on antiretroviral treatment or therapy. But not only that, 90% of those who are on antiretroviral treatment should have the effect or the positive effect of it. That is viral suppression. So that 90-90-90, which we're supposed to achieve by 2020, is necessary for us to eliminate completely the HIV AIDS epidemic or pandemic, whatever it is. But I can tell you that for us to achieve that, especially in Guyana or in the Caribbean, we must, let's say, triple our efforts that we're doing at the moment. There have been some changes. Our strategy have changed completely, where we start looking at what is referred to as different population groups and so on. And we started concentrating on them specifically. We start changing our, let's say, our attitude towards the different population groups. Like, for instance, we tried to make the different sites that somebody could go and get tested with the rapid result kits and so on. It should not only be like what we used to do before, a clinic especially designated for that. They should be in the antenatal clinic, they should be in the infectious disease clinic, the STI clinics and so on, and make it comfortable for persons of all walks of life to go in and have that test done. Okay, we've got to change that approach. And what is killing us in this struggle against HIV/AIDS is the stigma and marginalization that is attached to this whole this whole epidemic. And unless we change that, unless we can look at a person knowing their serology might be positive and treat them, with all their rights and so on, only then we would actually achieve that elimination and so on. The ARVs, that is the antiretroviral treatment, has been lower in cost, and it's now like 1 tablet a day, and it is less toxic. Okay, all of those things, even the testing has changed a lot. Where first you had to wait for a length of time and for them to inform you, and so on, you could actually get the results immediately, and we had to depend on that CD4 count to know what level it was. Labs would have come into play before we decide whether we'll treat you. Now, we learned from Brazil that, and from other countries as well, that from the time you are positive, we should place you on treatment so that you have less complications, and as a matter of fact, you literally don't have no manifestation of that sickness. So we've come a long way with respect to that. As a matter of fact, I can tell you that the treatment of diabetes in Guyana might be more expensive than the treatment of HIV patient. And this is good for us to know, because this helps in the elimination of the stigma that is attached to it. Okay? And then, as I said, the attitude that we have towards these patients. There's no doubt about the fact that men in the world is being left back, men and boys, because we still have this idea that being HIV positive is making you less of a man. And and we find men's attitude towards healthcare, that going to the health center is a function for women to do and so on, and that if I'm more macho, like, I'm less likely to suffer from AIDS and things like that. We've got to change that approach, and this is why I'm happy that we're developing that category known as men's health. But coming back to the mother-to-child transmission of HIV, all kudos, and we must always remind the world that Cuba has been able to eliminate this. But Cuba is a particular case. Let us not go and reinvent the wheel. Cuba struggled a long way. Their approaches had to change for them to reach where they are. And because they had gone through that stage, no other country should go through the stages that they go, and we should adapt the right approach. When you compare Cuba to Guyana, where Cuba is an island, where the regime is, the political system is different than ours, it is much easier for them to achieve that because we have got, let's say, all four of our borders, are on control. You come from Venezuela, you come from Brazil, you come from Suriname, or you go to these countries, or even you come probably through the Atlantic, and because that's how you really come from Venezuela, one of the means, and we have no control over you. We don't, so you find that it was much easier for Cuba to have their borders well protected and controlled, and as a result, they were able to achieve that complete elimination of mother-to-child transmission. What it means that all mothers must be tested, and those that are positive placed on a treatment, tested on time so that it wouldn't go down to the babies and so on. So in Cuba, babies are no longer born in HIV positive. We've come at some extent, as I said, but it's going to be difficult. Okay, it's going to be difficult for us to achieve that. And as I said before, there's so many factors that are working against us. There are some other areas that we have to deal with, like for instance, the prisoners. I mean, I got some flack. I saw myself in the newspapers in a cartoon sharing out condoms in the prison. The fact is that the prison population is double that of the free world outside where HIV positive is concerned. Now, my duty is to prevent this nation from becoming sick. And if it means that we will prevent the spread of HIV by sharing out condoms in the prison, then so be it.
Yeah.
Okay, we're not encouraging it, but it's happening. We have it available for them to do it. So all in all, I think, we've got to start respecting the right of men who have sex with men, with gays, with that transgender, that part of the society that we used to condemn before. We've got to recognize that they've got rights to equal access to quality health care and make whatever possible for them. We've got to start treating them right. We know that there are like about 78 countries that still have men having sex with men as a crime. Some, like 12, still exist in the world that punishes that crime by death, and so on. We've got to start working towards that if we are going to eliminate all these problems that we're having, because it's not only HIV, but there are other STIs and so on. Okay.
Okay, Minister, thank you. With regards to mental health, that's something that the ministry has been focusing a lot on. There's a strategy, there's a lot of partnerships. Can you tell me a little about the achievements that you have had in this regard, from the collaborations and so on?
Well, I'm happy that you mentioned this because that was my next topic, to try to ask probe you into asking me, because mental health is everybody's business. And while I might not want to go into detail as to say how much of it is public health, I am not in any way trying to shirk my responsibility or the responsibility of the Ministry of Public Health to take up their share and to take up other shares that are existing out there. But it certainly is not a Ministry of Public Health business alone. You have Social Security, you have social welfare, or all the different areas, communities, social cohesion, so many other areas come into it. But mental health, I think, might have been neglected. And I say neglected because for the longest while we had one Guyanese psychiatrist in the whole of the country working his hands off, okay? Many a times I stood up in Parliament. I remember motions being brought to Parliament with respect to the conditions of the Fort Kanji Psychiatric Hospital. Of course, we were in opposition then and a minority, so it was always voted down. And, I remember visiting the hospital just before my presentation. That's the Fort Kanji Hospital. Just before my presentation, the day before, okay? And I described vividly what was the situation there at the Fort Kanji Public Hospital. I even became poetic. I talk about slimy things that crawled with legs upon the slimy seas and so on, describing the drains and so on. Persons were more prepared to correct my poetry rather than to address the issue. Okay? But it remains the same. It remains the same. It is scandalous, okay, to say the least. And I always say, I remember the first time I visited, we used to call it the mental hospital then, where Queen's College run against Borby's High. On that ground, athletic sports, high level of cricket used to be played weekly in New Amsterdam on that ground. When you go there now, it's a pasture. It's a pasture with high grown grass and so on. I mean, in other words, we're dropping backwards. We're not going forward. When you go into that area, they're short of staff. Okay? Dr. Maida, who's a psychiatrist there, she's been working there all alone. And she has horror stories to tell you about it. The director, who I think deserves a national award, is there, but you can do so much. You can only do so much when you only care. Okay? And I can tell you, we need to do much more. I would love to see that being a one of the legacy that I can leave here as a Minister of Health, where if I can get that Fort Kanji Hospital, I'd grade it down to the ground and built over, okay, and get it functioning, the aesthetics of the area, the environment, everything. And you can hear good success stories about that place where it used to be a baker shop, where persons used to practically earn a living. Now, it grieves your heart to hear that when an inmate die at the Fort Kanji Hospital, only the staff and the inmates the residents would go to his or her funeral, as though they are the forgotten Guyanese. And we've got to become our brother's keepers if we really want to, let's say, have an impact on mental health in Guyana. Because I'm not only speaking about, the Fort Kanji Hospital, but all along the line. We've got persons with mental disorders that we just take for granted, or we find all the different excuses in the world to neglect them. And this goes right across the society, even in the medical profession. I remember visiting Bartica with our national psychiatrist, and he asked the doctor who was there, what is the condition here in Bartica with mental health problems? And he says, oh, we don't have a problem with that. We don't have a problem. And the psychiatrist from the hospital to where you catch the boat was able to count 17 patients on his walk there, which is about 4 corners, that needed treatment. And this again, I'm saying that the whole specialty of psychiatry has been neglected. And the reason for us having one psychiatrist for such a long time. So what we intend to do, or what we have started doing, is to get more psychiatrists. Okay? One of the safest way to do so is to ask for scholarships so that persons could go. Only recently, someone left on a pediatric psychiatry scholarship, and we've got some who are in training. But more than that, we have now started a postgraduate, a master's degree in psychiatry at the Georgetown Public Hospital. And that is the way to go. We're training 8 Guyanese doctors in psychiatry. Okay? So, that is some of the things I'm happy about. I agree, yes, that there was a strategy, hard copy strategy, but it was not completed. It needed a lot of reorganizing and so on. We took it up from there. We analyzed it. We corrected what has to be corrected. And we're running with it. We needed that mental health unit. We are hoping that we can get this mental health unit fully housed and located apart, separated and apart from the Georgetown Public Hospital or the Ministry of Health, so that they can they can run their show. And that is the way we're going. We have identified the unit, and we are working to get it functioning and running smoothly. Suicide, unfortunately, only when it was Saturday, I think, two persons commit suicide in the little island of Wakenham, you know, and suicide has affected Guyana so much so that one international magazine had even earmarked Guyana as the suicide capital of the world. Now, I don't know how accurate such a statement is. What I know for a fact is the world is not questioning that. While I, as Minister of Health, Public Health, or a Guyanese, would want to question that, if where you get the data from, you know, um, persons are not concerned about that. They accept it. So I'm saying this to make a point that sometimes we want to help and we end up doing more damage than anything else, because somebody is claiming that they have contact with these magazines and they can say these things about Guyana so that we will attract the sympathy of donor agencies and so on to come on board. But if you've got to berate our country in order for that to happen, then I'm sorry, I'm not on that board. I'm not in that board. Okay. However, it was noted as that this suicide thing was high. It is a fact, and it goes across the racial divide as well as the economic divide, whatever else would affect. Because we find that there was a very high incidence of suicide in the Baramiti area, a Carib community, indigenous, full-fledged, okay? But before Baramiti, in spite of the fact that this was happening for the longest while, people were of this idea that it was the people of Indo-Guyanese descent and so on, or that they were more involved with the agriculture sector where they were exposed to the pesticides and so on. But in Baramita, you had no pesticides there. What they actually did was hang themselves, So before we go making public statements, I think we've got to make certain that we're accurate, okay, and we just don't take it on whatever happens. It seems to be that depression is the main cause, okay, and this is from the psychiatrists themselves, that 90% of the causes of suicide lies in the community, but 90% of the solutions also lies in the community. That's why when the Baramita issue came to light, and it was there all the time. It was there all the time. But I knew about it, and as soon as I took up office, we had somebody coming down here to present the case of Baramita. And at one stage, it was one every 6 weeks. And when that 6 weeks time come, the whole village was just waiting to see who's the next victim. And we are working. We had a lot of visiting there ourselves, the medical team, the social welfare department, and the Ministry of Social Security, and so on, all visited the area, and we're working towards it. We brought some of the children from Baramita out and so on. But what we have noticed also is that, 3 persons in a short space of time, relatively, took their lives at the Kaieteur National Falls. The Kaieteur Falls. You don't go up there because for free. The amount of money that you kind of pay to go up there tells you that you are above board in terms of your resources. But it has become something of a novelty to plunge from Kaieteur. We've got a real problem on our hands. You name the profession, while they might, and because I can tell you in the medical profession they might not have been successful, but you had doctors attempting suicide. Okay, pilots were successful, managers, directors, and so on going after it. So we do have a problem with that. Now it brings us to the different persons who are coming on board. A few of them came to me, and we had discussions, and I said, I have or the ministry has an open door policy where we're willing to learn and we want everybody to come on board. Sometimes it can be a little difficult. Persons are coming with ideas that are not practical to implement immediately in our society. You just can't go into a community and says, let us change this into a psychiatric hospital. And we're going to, it's not going to happen like that. We've got, so many evaluation to do and so on. We've got persons who want to come and hold a workshop and then leave. Persons who want to come and probably form an NGO, who are overseas based. We don't know. What we're saying, the mental health unit of the Ministry of Health is here to stay. We are local here. It is our responsibility. We have our officers in charge and so on, and we hope that persons would entertain us, or let's say persons would keep us informed with what their actions are. We tried the hotline, okay, where persons call in. We're not a perfect society, I can tell you this, and irrespective of what you might want to put in place, and that looks practical in theory, when you put it into practice, it's a total different situation. I cannot openly say that it was a success, that it has prevented suicide. Persons did call in. They might have not had the best response or the response that one would think that they will get, but eventually we will get there. We will get there where somebody call up and they get the right response. I'm saying let us still give it a try. Let us still use the hotline. I mean, as I said, we're not perfect. The 911 thing seems not to be working. Okay, our hotline for that number, sometimes you might not get the desired result, but don't let's give up, because it's a certain the strategy that we can use to curtail this. Yeah.
But there was a case where a 17-year-old did make contact with a hotline, and he did receive a good response, because I can remember the story going out saying that they were able to talk to him and he was able to tell them the problems he was having, and they even made contact with the community health worker in his region. So I don't know if you're aware of that.
I know, but that's probably one of the cases where the response was good. But here again, how much would a community health worker know of how to deal with somebody who's attempting suicide? You need much more of a social worker, or yes, somewhere along that line, and that is one of the areas that we need to improve on. We need to have more counselors available, more social workers. They are so important in our society, in all of our society. So I think that if we continue to use the hotline, talk about our success stories, persons will be more encouraged. And it does not necessarily have to be the victim. Okay, it could be somebody in the society, and that's why I said we've got to start being our brothers' keepers. Let us, or you see somebody acting strange and so on, and we should all come out with a national effort to curb the suicide rate in Guyana.
Okay, Minister, thank you for that. With regards to food and drugs, the unit is there. Can you tell me a little about the monitoring? How are you monitoring the vendors, and what is really going on within the unit?
No, I don't know why you brought that up, but I'm glad, because somewhere along the line, that impression is being peddled out there that this regime might be anti-business, meaning the businessmen are complaining, complaining about their containers are held up on the wharf and that they're being harassed by the agencies. And I have written complaints, persons visiting me about their dissatisfaction about what is taking place. I even had an open discussion with the Ministry of Business with regards to this. Now, I must say this publicly. Whenever a complaint is made, I call up who is in charge, the Food and Drug Department. The same complaints, the same individual, their names and so on, we discuss their cases individually as well as the general, because persons can go to the press and persons can say, whatever it is about the press. We can ill afford a bad press at this point in time. So I will do everything possible to make certain that persons are comfortable doing business here in Guyana, but within the realms of the legal aspect of it. We had situations where persons were doing things before, and this is where the discomfort comes to me. Persons claim that, that they used to do this before, but now they're asked to provide different documents, which stymie their operation. When who is in charge is asked to explain the actions or reason for the actions, it's there written in the legislation that you have to do certain things before you can offer, for instance, a product for public consumption, and providing you do not compromise the state of health of the nation, okay? I don't see why measures shouldn't be, should not be put in place. The thing about it is, it is very easy. For instance, let's take for instance what you call repackaging of a product. Unless you have, and this is simple, a proper hygienic system in place, that product which you put out there for sale in the supermarket can only be done so under particular conditions, and if you don't, you can either be prevented from doing so, or you can ask to remove it from the shelves. It can be taken off the shelves. The Food and Drug Department is saying that when actions were, or when they advise certain, let's say, producers of product for the public consumption, when they notified the managers of these places that they are violating health rules, they were ignored. Okay, they were ignored. And they have now reached the stage where they're going to probably get legal actions against these persons. But it means that you probably would be putting people out of a job, and you would be preventing somebody from earning a living. But we cannot encourage any form of, let's say, importation and distribution here in our society that will compromise the health of the nation. We cannot do that. We should not allow it to happen, and we will not encourage it. Okay.
Okay, Minister. With regards to international partnerships, there's been a lot of collaboration, and you did mention that you've been taking flocking for that. Can you elaborate on some of the areas that you'll be working in with these partners, and what are some of the partners?
Well, public-private partnership is an area that we cannot get away from. And we only manage to improve the quality and the access to certain health systems, or let's say health provisions, because of private-public partnership. Some has been a total success. I can tell you openly about in cases of surgery, like for instance the interventionist cardiology working here. The Caribbean Heart Institute is, as far as I'm concerned, is a success story.
Yes.
Okay, because you can get a stent implanted, and different other cardiac surgeries can be done right here in Guyana. that you would have had to go abroad to do it and so on. And the patients are doing well. Okay. Similarly, in imaging, that is where there's CAT scan, MRI, whatever it is, the different form of X-rays and so on with contrast. That is also a public-private partnership, okay? And here again, you could have only been able to have access to this because of that. Granted that it is time the Georgetown Public Hospital, the Ministry of Health, start looking at owning their own CAT scans and so on. They have now their ultrasound, which has become a routine something. But ultrasound before not so long ago used to be in the domain of the private sector alone. Okay, so we are improving along that line. Then you've got, of course, the oncology clinics, that the cancer treatment, the cancer centers, and so on. We have patients who are exposed to radiotherapy, chemotherapy, and it is done right here locally. Seldom they would have to go abroad, and so on. And it's improving in the technology that is being applied. So we are going along that line in terms of our private-public partnership. But there's another form in which we benefit. We've got, for instance, a collaboration with some NGOs abroad. Like, for instance, the Help the Kids Foundation based in Canada. That again is a success story, where the neonatal units and the training of our postgraduate, our postgraduate course pediatricians, the fellowships that they're exposed to, and the fact that they're working right here in our hospital, more cannot be said about them. I've seen our postgraduate students being exposed to, for instance, what is referred to as a digital hospital in Canada, the Humber River Hospital, which is top of the line hospital, one of the best in the world. And most of our postgrads would go there and see what is taking place and so on. Of course, we cannot hope to reach that stage in the near future, but at least you get an idea of where we can go, and it stimulates the doctor's interest in that area. But Help the Kids Foundation and the neonatology unit here in Guyana is one that I think it's an icon of an NGO that so many of the others who are clamoring for letters of acknowledgement or letters of gratitude from the Ministry of Health should emulate. They help substantially in the care, in providing health care for our babies here. And of course you have Baby Heart Institute, where persons come down to Guyana, operate on babies, where you have, for instance, in the last Baby Heart outreach that we had here to Guyana, 17 of those doctors or healthcare givers were volunteers. We had to pay 3. Granted that, yes, it's a large amount of money that we had to pay and so on, but we can account for it now that we insist. That again is a success story, because those patients would now be living a normal life, and extended period, would have died under normal if they have been left unoperated on. The good thing about Baby Heart is that people do not realize that when you do those complex surgeries, heart surgery and brain surgery and so on, the follow-up is very important. And we have been sending patients abroad to other countries to do cardiac surgery, to come back and no follow-up. And the authorities are saying, the specialists in the area are saying, that these surgeries should not be done and patients should be left to go without follow-up and to see how they're doing. With Baby Heart, we're getting along that way fine and so on. And more persons are coming on board with Baby Heart. The thing about Baby Heart is that there again, the training of the nurses, okay, we get a flack every day for our nurses' attitude towards patient, and it's something that is worrying me. But I can tell you there are some good nurses still, especially those in the pediatric area. We can tell you about so much quotations that the mothers in Bort would have received from nurses, and they tend not to forget, that is the mothers, of them being abused verbally by nurses and so on. In the pediatric area, I can take my hat off to those nurses. I've seen them working beyond the call of duty, and it really is encouraging to be in that area. So, those are some of the areas that we get input from partners, whether in the business sense or volunteers coming here to work. Of course, one can always make mention of the outreaches that come into Guyana with doctors and nurses and other healthcare givers, and go to the outlying areas and do clinics and so on. Those are some that we would certainly encourage and follow up on, and that we are, on behalf of the Guyanese public, grateful and thankful for the efforts that are being made.
Minister, time is against us, but there are a few other things that I want to touch on briefly. NCDs. There's a lot going on in that area, but I don't know if you can just give me a synopsis.
No, NCDs we used to take NCDs for granted, not recognizing how much it affects the economy of the country. But not only that, how little it takes to prevent these NCDs. The NCD is a non-communicable disease.
Yes.
Okay, we talk about diabetes, cancers, high blood pressure, cardiopathies, and so on. And it all boils down to lifestyle. We took lifestyle for granted in Guyana, where we eat whatever is there on the table. Okay, we don't want to go and do any form of physical exercise. Working is not physical exercise, and it must be pointed out. It is not the same where you are, let's say, sweeping the floor and you be panting for breath, than for you to go outside and do some freehand exercise and you end up panting for breath. It's two different things altogether. It's two different things altogether. So we've got to understand that. I mean, in Barbados, for instance, as I said before, a ban was placed on sugar because of our eating habits. We don't need sugar. We don't need salt. It's our taste that makes us do this. We've got to try to cultivate the correct approach to eating to eating in our children. We must avoid, and I'm saying this openly, avoid the aerated drinks. Avoid it at all costs. Those snacks, we call it the ultra-processed food, the Bigfoot and the this and so on. We must get our children away from. Most of them are either oversalted or oversweet. Okay? We must get them away. We got to get back in the old system of drinking water. Okay? And what is even, let's say, even more alarming is we tend to want to buy these energy givers, like the Red Bull and those kind of things. Then we really don't need anything at all. We don't need that. I don't want to sound political, but I must tell you that only recently in an international conference that I attended in Brazil, it was pointed out by a study done in Trinidad that in the Caribbean, during the time of the banning of foodstuff in Guyana, we had the best health index here in the Caribbean. Okay? And these are some of the things that Guyanese would not want to believe. But when we start using our plantains and our cassavas and our sweet potatoes and forget about that which is imported from abroad, when we're using our own carrots, our own pak choy, our own whatever you call it, we would start having better health. Better health. Definitely. When we start drinking our coconut water that's grown right here and cultivated, we have no need to now, forgive me for saying it, but somehow our Guyanese children has grown to believe that chubby is theirs, and I know I'm coming up against the business of it. Our children just feel that that is part of their life, the chubby, okay? Nobody ever thought that, listen, I should at least get some fresh coconut water for my child or so and things like that. And there's so much benefit to gain from that. You know, I can tell you, my sons, for instance, never ate greens until they learn to understand what it is, because they used to pick it out piece by piece from the food. We've got to start cultivating that habit of fresh green vegetables, and you know the provisions. Got to go that way. We get all the minerals we need, and our fresh fruits. We've got to start going in that direction so that we can avoid the heart problems, we can avoid the diabetes, we can avoid the cancers, the vascular problems, which is like varicose veins, and the more dangerous one of cerebral vascular accidents. Every now and again we have a embolism or a thrombosis taking place and people dying and so on, and young persons at that. We've got to start it, and that is a very, very important area that we must take into consideration in our health sector.
Okay, Minister, thank you for that. Going forward with 2016, what are your plans for the ministry, and what are some of the target areas?
Well, first of all, we have to improve on our primary health care, and I'm happy that we managed to access funding to improve the primary health at the primary health care level of 3 hospitals. That is the West Demerara Regional Hospital, the Saudi Regional Hospital, and the Bartica Regional Hospital. With those areas where we're looking at both infrastructure as well as the actual provision of health care in terms of equipment, medical supplies, and so on, we are looking forward to the improvement in that particular area. Okay, and as soon as we can get things on, we will start working with that. But as I said before, my drive is to work on reducing the maternal and infantile mortality rate in Guyana, and of course to work closely with the mental health unit of the country to see if we can bring mental health under some semblance of control.
Okay, Minister. Anything in specialty hospital?
Only to say that, sometimes we have some good deals, sometimes we tend to want the perfect situation, which seldom exists. We've got an offer by a reputable company. I think it rates among one of the 5 largest company in the whole of India, to make us an offer, okay, with regards to building the specialty hospital that was started and that was abandoned, or at least the contractor was laid off, to do that and to complete it within that designated amount of money that is, and it's even prepared if the needs be that they should go over that amount of money for them to facilitate that spending.
Thank you, Minister. With regards to the season, is there anything you want to say to our viewers?
Just that 2 things. The season is one where we up our consumption. And as you increase your consumption, particularly I want you to bear in mind 2 things. The tobacco increase, okay? Do us the favor, do us Guyanese the favor of smoking less. And secondly, consuming alcohol less, okay? While I am grateful if you can go with a designated driver, I still think that you should go with the idea, rather than of a designated driver, of consuming less alcohol in whatever form. We don't have to be any statistician or epidemiologist to know what driving under the influence is causing to the Guyanese public. And we must bear that in mind during the festive season. And remember your blood sugar level and your blood pressure level as you celebrate the Christmas.
Okay, Minister, thank you very much.
Okay.
Thanks for being with us.
All right.